This is EWA Radio, the podcast of the Education Writers Association. I'm public editor and your host, Kavitha Cardoza. I'm delighted to welcome a reporter I've long admired and listened to, Anya Kamenetz. She's been the education correspondent for NPR from 2014 until a couple of weeks ago.
Yes. Mm-hmm.
Hi, Anya. I'm so happy to chat.
Hi, Kavitha. And of course, the admiration is mutual. It's always been fun to collaborate with you the whole time we've been on the ed team, and I miss that a lot. So it's nice to be back in touch.
Thank you. Anya, I want to jump right into our conversation by asking you to read from your book,
Okay.
The Stolen Year.
Sure.
On page 4, from the sentence that starts, I used to have a mini pep talk.
Mm-hmm. Yes, of course. So I used to have this mini pep talk I would give about why education was a worthy beat for a journalist. I would say, this country doesn't have universal health care. We are profoundly weak at providing subsidized, affordable housing, mass transit, or other public goods. We have no childcare system to speak of, no paid family leave. But we do have this beautiful phenomenon where in every neighborhood, in every city, town, and rural community in America, there is a warm, lighted building that children can go to for 180 days a year. There they will be safe, they will be fed, and they're likely to encounter a caring adult or two and maybe even learn something, all for free.
I have to say, Anya, when I read that, I stopped, I teared up, and I read it so many times. It's such a beautiful sentiment.
Thank you. Yeah, and you know what that means, more than a lot of people.
But COVID and our reaction to it kind of changed that, right? So suddenly schools were not seen as an essential service. How did that happen and why?
Yeah, that's really what the book is trying to answer. I think that the essential nature of the services school provided were hidden because of our incredibly divided country and how unequal it is, so that the people who were closest to decision makers and had the most leverage didn't experience how essential schools were. And so it was hidden from them. And as that impact compounded, it continued to be hidden and subsumed by other concerns, which were great. Concerns were absolutely enormous. But we didn't have this bedrock sense that as a country, we're going to prioritize children in our decision making. Not just vulnerable children, but all children.
Did that surprise you? Because I think if someone had asked me before COVID, I would have said, yes, I mean, of course, if something awful happens, we would prioritize children.
Yeah, it shocked me. And as it continued, it shocked me more and more because the detrimental impacts of school closures were absolutely clear from the beginning. There's a full literature from around the world on the impacts of school closures in the modern era. And it was not regarded. There seemed to be no person at the wheel who was capable of making the decisions necessary to keep our schools open in a safe way for kids.
You follow children from across the U.S., San Francisco to St. Louis, Oklahoma to Washington, different ages, different circumstances, and you have 2 daughters in New York. So you were seeing how this stolen year played out up close. A couple of years later, we have kind of hard evidence of what people you had spoke to originally, feared the effects were going to be. And I've seen words like it's devastating. I've seen words like gruesome, outrageous. Tell us a little bit about what we know now.
Yeah, I mean, kids didn't learn as much when schools were closed. Remote learning was no substitute. And particularly the cruelty of remote learning in the world of, these things happen, right? We've got floods in Pakistan right now, right? Schools close, disasters happen, schools close. Continuity efforts are important, but they can't reach everyone. And in fact, the people that they reach are the most resourced people. So we know that remote learning exacerbates inequality, and we know that children don't learn as much. We should have known and could have known and are seeing now that depriving children of their main social contact and from the caring adults that they see in school is devastating for their mental health. And the hopelessness, I mean, the pandemic was crushing for everyone's mental health. But seeing the impact on little children is really hard because they are typically not presenting with as many mental health problems. And so it's a long-term problem. And then, I go into kind of the impacts on children with disabilities and those who are touched by the criminal justice system and the family welfare system and so many other parts of our society.
The story about the 11-year-old child in California who is autistic and dyslexic, and he was so frustrated by his Zoom classes, he cried to his parents like, "I want to die. I wish I could kill myself. I want you to kill me." I mean, that was just awful to read. I was wondering what story made you the most angry? And I should say I use the word angry because it felt like there was an underlying anger through the book at the injustice of the year, even though you wrote like very early on that you saw the book as therapy or restorative justice. I kind of felt, or maybe I was just
channeling.
Yes, projecting. But I felt anger. No,
I think that's very valid. Yes, it makes people very angry. I think it's totally it's okay to be angry in therapy. There's a process we have to go through here, and it's not always going to be pretty. But when you say angry, Kavitha, the person I think of is Habersham. That's the pseudonym that his mother chose. He's the middle child of 8 children of a single mother in St. Louis, living in totally inadequate housing. I mean, honestly, their landlord should be jailed. Like, they didn't have heat in the middle of the winter and the ice storms that St. Louis was going through in that winter of 2021. And sometimes they didn't have a refrigerator. So she's going to an essential job at a homeless shelter. The kids don't have daycare. She's locking the door on them. And one day he runs out. He's playing with friends. The neighborhood is just totally blighted. It's full of empty lots filled with trash and empty buildings. And he goes into what's supposed to be an abandoned building. Potentially it's being used by drug dealers, which would explain why there's a man in there with a gun who shoots him in the leg, shoots his friend in the wrist. This is a 7-year-old boy. And the newspaper refers to him in the headline as a burglary suspect. And then there's a police officer quoted speculating that his mother's on drugs. It's like completely egregious. And then the city's response is to send, Department of Social Services to her house, scolding her for not doing floor time with her children, totally irrelevant advice, not giving any help. And this kid's totally traumatized. He's like, he wants to buy a toy gun. He's obsessed with guns now, wants to protect his family. Just so many failures. And the audacity of any person to blame his parent for that and to call him a criminal. It drives me crazy.
Mm-hmm. I feel like that's so often the narrative around poor people or people of color, like, the automatic story. But that leads me to something when you talked about the newspaper stories, Anya. I want to bring it back to education reporters. A lot of education reporters covered this story, covered it like endlessly. What do you think education reporters could have changed the way the story was told? And if so, how?
Yeah, this is a tough one because I don't want to be in a position of criticizing my colleagues, especially those who had less resources than I did at a national outlet. I put the onus on the newsrooms themselves because education reporters weren't tapped as the experts on children's well-being that we are. There was this, at least at NPR, this understanding that we defer to the health and the science reporters. They're the ones who have the sources, and they're the ones who need to be interpreting what the pandemic is all about, and they sort of have the top line. And there are many times when my stories went to those editors. But that was hard in itself because obviously they're overwhelmed. They have a huge story to cover, and we're just in our lane. And the question is, what exactly was our lane, right? How vociferous could we or should we have been in stating from the outset because we know how many kids in the districts that we work in are homeless. We know how many are poor. We know how many are, trying to access mental health care and having trouble doing so before the pandemic. So, how much time could we have spent beating that drum versus the stories that we did publish, which oftentimes centered on these debates over what mitigations practices are going to happen, or what the union is saying, the conflict frame, this person saying this, there's that, versus the very basic. And I mean, it was the very basic that, when a child during a weekday is climbing through a window and getting shot, why? He's not in school. Why is he not in school? Okay, this is happening because he's not in school. This is a danger to his life.
Right. I remember my first thought when schools were closed was about school lunch programs.
Yeah.
I know in Washington, D.C., a lot of children rely on school. It's not just lunch, it's breakfast, and sometimes it's supper as well.
Yes.
You seemed like you were trying very hard, Anya, in your book, not to blame anyone or point fingers. And I'm curious why.
I felt like it was a lot of blame to go around. I felt like it was a perfect storm. And there was massive failures of federal leadership, White House, Education Department, Public Health Administration, massive failures. There were failures on the state level, very few states, exception of perhaps Rhode Island, Connecticut. Governors stood up and said, this is definitely happening. We're definitely opening schools. There were failures, the haphazard and disorganized and decentralized nature of our schools districts made it almost impossible for them to integrate the latest changing public health guidance and create plans that they were able to stick to. So, I guess there's, it's like blame that went around so many different places that it's almost everyone and no one. And it's not a satisfying answer because there's not one villain.
Right. One, because I didn't grow up in the US, but also because I want people to understand that what happened in the US was not a universal story.
Yes.
Right? So talk a little bit about what other countries did and how they managed to do it.
Yeah, absolutely. So schools closed in 190 countries. They closed for 9 out of 10 children. This has never happened before. Globally, the scale of disaster is much, much bigger than in the United States because the large countries that are developing countries with large child populations stayed closed much longer. And what happened to those kids in the absence of good social services structures in Brazil and Bangladesh and India and Kenya is a terrible disaster that it's basically scrambled the UN development goals. Like UN had a set of development goals. They got all these children into school in the last millennium. And now it's like trashed. They're not going to meet their development goals for the next little bit. And getting back even to where we were is going to be a huge lift. Then there's the rich countries. We are the outlier among rich countries for how long we kept our schools closed to how many children, while also sustaining this horrifically high level of death. So we can't even point to that and say, well, the children took a harsh dose here, but at least we saved lives. No, we didn't save lives. We killed 1 million people are dead. So there's very little to recommend our pandemic response. When it comes to our peer countries, you can look in 2 groups. There are those who controlled the pandemic, controlled cases, right? They reopened schools with zero controversy because they didn't have cases. New Zealand, Japan, South Korea. Then there's our peer countries that dealt with waves of the pandemic. Europe, a little bit of Israel. They dealt with waves of the pandemic, but they did not close schools again. They opened them starting in the spring, absolutely by the fall of 2020. There were clear directives from the European equivalent of the CDC saying schools should close as a last resort. And that was the policy that their nationally organized and administered public school systems followed. They closed bars and restaurants instead of schools.
Do you feel hopeful that if there was a new pandemic or some new disaster, say in 2023, right, God forbid, that we would do things differently in the US?
I'm not sure that I can say that I'm hopeful. I think that some of the information is there. Some of the relationships are there. One thing that we can see happening is that districts are pivoting to remote for all kinds of reasons now, ranging from it's too hot in the classroom or
it's too cold.
It's too cold, right, exactly. And so that's a little bit troubling because we know it's an inadequate substitute. And in previous years, they would have simply added those days right onto the end of the school year. So I'm not sure. I'm not sure that we were going to deal with things any better. We didn't put into place any new structures or programs permanently that could help. So I don't know how, that's the first thing that we need to do if we want things to go better next time.
I'm Kavita Cardoza, host of EWA Radio. My guest is Anya Kamenetz, longtime NPR education reporter and author of 5 books, including a brand new one everyone should read, The Stolen Year: How COVID Changed Children's Lives and Where We Go Now. So, Anya, I know the question on every reporter's mind, I mean, certainly on mine, was I was struggling to just keep my head above water and manage daily reporting and home responsibilities. And you did all that and you wrote a book? Like, what the heck? How?
So thank you for saying that. I think, so to be totally transparent about it, my daughter's Montessori school opened in July of 2020. My 3-year-old at the time daughters. So I had full-time coverage from July. That was huge for my younger child. I also had a partner at home who was willing to split childcare responsibilities, even though he's making more money. So that was really different from a lot of people. And that private Montessori school never had a quarantine closure. It was small, 40 kids, and families pretty much stayed in town. And in terms of how I structured the reporting, there was a nice interplay between my daily reporting for NPR and the reporting I was doing, where one kind of fed the other a lot of times. There certainly became a point where I had to wall off some of the reporting I was doing for the book. But I tried to let my expert interviews really feed my daily story so there wasn't too much stolen time, so to speak. And, it was therapeutic in a way because it helped me in the darkest moments of the pandemic feel that I had a little bit of the observer mind on, like everything is material. So even if I'm having a really hard day or a stressful time, I can use it. And also the experts I talked to were helping me have perspective on what was happening even while it was happening. So
that's so interesting because that was going to be my next question. Like, how did you, like as reporters, so often we're focused on the here and now and like what's immediate.
Yeah.
How did you zoom out and take the long view?
There's a piece that I published in April of 2020, April 2nd to be exact, that laid out what the research said would be the long-term consequences of the pandemic. And I sort of followed that as a guide for themes as I went along and thinking about, well, this is what we're seeing here, and these are the early indicators of this. There were other things that came to me by nature of being out there on social media and also reporting. For example, like I say in the book, I was cold called by mental health professionals to tell me, starting in June 2020, that this was a really big deal for kids and their mental health. So it was kind of serving as a, I don't know if I want to say lightning rod, but a reflector, somebody who's like got an eye up, and I'm kind of catching. I'll think of like, there's the amazing job of like fire towers where you're out there and you're like spotting the fires. That's kind of how I felt.
Mm-hmm. That is a really nice image. So let's get like more granular now,
Yeah.
Anya. Talk to me a little bit about your process. How did you find these families and children? And how did you follow them? Because you couldn't meet them in person, right?
Right.
At least for several months.
Right. So that was a handicap, but it was also helped me to be more efficient, right? I think if I was reporting a book like this in normal times, I would feel obligated to go meet them regularly. And that would have been a lot more travel, a lot more time. There were 5 families that I chose to focus on. 2 of them, Jeannie and Patricia, came to me through a call out that we did for NPR where we looked for teachers who were also parents. That's Jeannie in Oklahoma, Patricia in DC. Dara, I was in touch with almost from the beginning of the pandemic. She had become like a public-facing person as an ER doctor who got COVID in March 2020 and also had a child who was a transplant survivor. Maya and her family, the stepfather in that family, was a newsletter subscriber for me. So he reached out to me and said, we have this really unusual situation. We've taken in this foster kid. Would you like to speak to us? And they were just incredible collaborators. And then Heather I found by cold calling homeless liaisons for several different school districts. And actually, I think it was another newsletter person who was like, you should look at St. Louis. St. Louis is a really interesting city. And I was like, oh, the Midwest, that makes a lot of sense. So cold called a bunch of people, finally got someone I remember really well because her name was Deirdre and she had a 504 area code. And that's New Orleans. So I was like, oh, I made a connection with her over that. And then she called me back a couple of weeks later. It was right after Christmas. And she's like, I've got this woman in my office who wants to talk to you. So I hooked up with most of these families actually in the summer, fall. So some of the reporting I did had to like look back and even get them to look at their emails and things to reconstruct from March until the summer. And then from then on, it was checking in on Zoom, Zooming with the kids, monthly, weekly, depending on what was going on, definitely at certain inflection points during the year. And then in April, when I was vaccinated, was when I did my road trips and went around and actually met everybody.
So these are kind of a lot of kids to kind of keep track of over an extended period of time. So how did you organize your notes and when did you start writing?
How did I organize the notes? I did all Zoom recordings. I had transcripts of everything. And I'm not sure how I organized my notes. I had a file for each person that I sort of went back and redid in chronological order as transcripts where they're talking about like certain points in the year. And I was writing, though, all the way up till fall 21 because I was waiting for the Build Back Better bill to succeed or fail because that was something I dealt with in my conclusion. Very disappointing conclusion. Yeah, so that's kind of how I did it.
And did you know all along that you were waiting for this to end? Or this feels like, in some ways it's not over. You could have kept reporting, right?
Absolutely. I could have kept reporting and going into I guess that would be the fourth school semester, there were so many things to kind of track. But I also felt like there were themes that were recurring by that point. There were lots of things that we already kind of knew and had seen. And I was pretty confident that it was going to be covered in the book.
I just really liked how immediate it felt. Like sometimes you have a book come out and it comes out like years later and you kind of feel removed from that situation a little. And this felt very immediate to me, this zoom out.
I appreciate that. It's something I stressed about a lot because there were points where I thought it was going to be all over by fall 22 and people would want to put it behind them. And you never know with a book like this, but I think the timing did work out well. Although I also hear from people who are like, it's too soon. I'm sorry. I can't get it. I can't dive into this right now. It's too painful. So I get that also. I mean, even for me, when I was recording the audiobook in June of 2022, I was like, it was a journey going back there and the blow by blow for sure.
I wanted to ask you if you were kind of say, had a magic wand, right? You were in charge of education in schools.
Yeah.
What were the 3 things you would do if there was another event that necessitated closing schools?
So, I mean, every disease is going to have a different risk profile, right? So we happen to be with COVID that children were at much less risk, although not no risk. I feel like I've really come to see schools as an essential service. And so the question is not do we keep them open, but how do we keep them open? And I could have seen a situation, and this is done in a limited way, but too limited, where they are open to the people that absolutely need them as safely as they can be. That's how I would approach it. If you can keep your kids home, if it's a situation where there's a spread of disease and that's what we're worried about, if you can keep them home and you can keep them safe, okay. But we want to make sure the kids have a place to go if they need a place to go.
The title of your book is The Stolen Year. Like something was taken, right? What needs to be given back so children can, in a sense, be made whole?
Yeah, absolutely. Look, I mean, children need resources to recover the learning that they missed, and they need resources and services to get back to a mental health situation that gives them hope for their futures. But the essence of both of those things, I think, is giving them this experience, like the ability to make sense of it on their own and not to be marked from the outside that they're COVID kids or that they're damaged or that they're less than. I really think that we owe it to kids above all to respect them and to see them as whole and to see them as full of potential despite what we put them through.
We're talking with Anya Kamenetz, longtime NPR education reporter and author of several books. Her new one is called The Stolen Year: How COVID Changed Children's Lives and Where We Go Now. I would urge everyone to go out, buy it, and read it. Thank you so much, Anya, for making the time to chat.
It was my pleasure. Thank you so much.
That wraps up this episode of EWA Radio. I'm Kavita Cardoza. Do you have any questions for Anya Kamenetz? What was your experience covering COVID and children? Let's continue the conversation on Twitter @EdWriters. The mission of the Education Writers Association is to strengthen the community of education journalists and improve the quality of education coverage. For more than 75 years, EWA has helped reporters get the story right. Thanks for listening and lifting up education journalism.